When people are assessed based on the Care Act 2014, there are needs. Sometimes people need support with their personal care, they need support with toileting, they need support with meal preparation, sometimes they need support to prompt with their medication. So when those needs are identified, all right, now based on the assessment, if those needs are identified, we can commission carers to go in once in the morning or twice a day or 3 times a day to provide this support. All right, the way we work towards the independence of a home, if somebody is discharged home with, let's say, 4 times a day, and we have other professionals within our team, like the physios and the OTs, they also go in to try and improve the mobility, to try and improve the functional bits of the person. And gradually, once this service user gets, their situation improves, they are getting their confidence back, we can reduce the call, from 4 calls, sometimes to twice a day, morning and evening, so that's because they've improved. So we now have a new baseline, so instead of the 4 calls, we've reduced this to 3 calls because of working with other professionals in our team. And on some other cases, we have people that have gone in with what we call reablement. And reablement is for people who were once independent, came into the hospital, or not even, or people were at home who once had their confidence, could manage things themselves, but because of some health issues, they lost their confidence, they lost the ability, the skills to manage daily. So we put in reablement to ascertain, a new baseline, to ascertain what they can do and what they cannot do. They also provide support with, with personal care, with preparing of meals, with they prompt with medication, they help with toileting it. Now, they work with the service users to regain their independence. They work with the service users to regain their confidence. Now, they work with the service users to get back to their previous level of functionality. And so as a whole team, we are able to reduce the amount of calls. If, for example, a service user was discharged with 4 calls a day, now with input from other professionals and with the independent assistant going daily, we are able to reduce it from 4 calls to 2 calls a day. So that has reduced the resources available, and also it has helped to build the confidence of the service user. The social service team work with resources that are valuable. Now we work with the voluntary organizations like One Hackney, we have the Age UK, we have the Assignment Society, we have, there's a team we call Hackney Shine. Now these are, they help to do like befriending service, they help to fill forms. We can signpost service users, towards these organizations to help them, with the resources or the services that are available in the community. Also, the family is a massive, very huge resource. We always encourage family members to get involved, in supporting, providing support to their loved ones. So the family unit is very, very resourceful. Empower them means, to ask them what is really vital to them. How do they see themselves, and how do they want to get, supported? How is the best way they feel they can be supported? How do they want the service user? How do they want, the independent assistants to support them? How do they see themselves getting back to their previous level of independence? So we get the wish of the service user, which is very important. We get their wish, and we see, their contribution is vital as part of the care plan. So we get that contribution or that feedback for the service user and make it as part of the care plan, so that they are not they are not outside the care, they are part of the care plan. Their wish is part of the care plan. The things that they were doing, things that they used to enjoy, before this, episode of health issues, the things that they used to enjoy, they want to see how we can support them to get back to their routine again, to be independent again, to manage themselves again, to get things done themselves, to be able to do their shopping. We encourage online shopping. We encourage telephone shopping. These are services to use to empower service users to manage their daily living task.
This has set up a new way of how social workers are working. With the coming of the Care Act 2014, it meant that there was a national eligibility criteria set out that has to be recognized by all local authorities. This means that a local authority must assess an individual who appears to be in need of care and support, regardless of whether they will meet the eligibility criteria or not. Having said that, when we go out to assess as social workers, we are looking at how the individual may have a disability or medical conditions that impact on their well-being on a daily basis. We are emphasizing on the person's well-being, because if the person is unable to attend to their personal care, this is going to impact on their well-being in such a way that they cannot live well in the community, feeling at ease. Maybe they may feel like they are uncomfortable when they sat next to their friends or family, things like that. So this is what we are looking at from the social work perspective. It has emphasized more on advocacy rather than previously. So when we contact the individual initially, we speak to them, we tell them what we do, and then we tell them what the assessment process is. So we ask them whether they are fine to attend the assessment on their own, or they would like to come with a friend, a carer, it may be a family member. So this other person advocates on this individual's behalf. They may be able to put across views that the individual may not feel free or may not be able to put across themselves. It may be because of barrier in language, communication. But with the coming of the Care Act, as practitioners, we are specifically looking out that this individual is representing themselves clearly. The process of eligibility, when we go out, we are looking at how the individual manages at home on a daily basis. Now, if the person has a disability that impacts on their ability to complete their daily living tasks, for instance, personal care, they are unable to access community, their situation means that they don't have suitable accommodation. So if it's found that the person has two or more outcomes which they are unable to achieve, then this person is eligible for publicly funded care and support. So we complete the assessment, include all this information that will have been gathered during the assessment process. It may be what the GP is sending, the therapists who are working with this individual, put it together to form what we call an assessment. So the next process after that will be to complete a support plan. All this we do together with the service user. So we look at the needs that we have assessed them, and then we look at how they are looking to achieve the outcome. So we ask the clients, how are you looking to achieve what you are looking for from social services? How can we best support you to see that you continue living independently in your own home and within the community at large? So we write a support plan pointing out what what services we are going to be requesting for from the panel. A panel will be like a board of senior managers who will look at the assessment, the support plan, and then agree or disagree whether the individual has to be publicly funded by the local authority. It is emphasizing as well that we think outside the box. We also look at other resources available to an individual, for instance, family members, friends. Some individuals, they may not be able to attend to their personal care, but they may have a family who is happy to provide that support, and they are happy to continue doing that. So that will be seen as a need being met because there is that individual who is providing that kind of support at a no added cost. This is an option provided to clients to see that they have more control and choice over the support and services they receive. This is where the local authority pays the money into the account of the client, and they can manage this money. They can hire somebody to come in, support them. It may be somebody they know very well, but it's not supposed to be an immediate family member. So this is good in a way that they have control and choice. They can choose as per when they need to use the money, as per when they want the carer to come in. So we recommend that people take this option more often. Some people may think it is too much to deal with because obviously the individual will need to prove that they are using the money for what it's been provided for. However, it is good for choice and control.